Medicare is in for a major overhaul, with a new report likely to suggest sweeping changes to ensure Australians can afford to see a doctor when they need one. It follows a startling admission from the Health Minister that Medicare is no longer fit for purpose. Olivia Casely has this report.
Too many Australians simply can't get the care that they need when and where they need it out in the community.
Forget cost of living pressures and soaring power bills. Mark Butler says fixing our broken Medicare system is the government's most important challenge.
Labor has no higher priority than strengthening Medicare and rebuilding general practice to ensure that Australians get the world-class health care they need when and where they need it.
The Health Minister is vowing to strengthen Medicare, foreshadowing a major overhaul that could include the system being expanded to cover other health professionals such as nurses, pharmacists and paramedics. Under the proposal, paramedics could be funded under Medicare to treat patients in the home for wounds, or pharmacists to give people scripts for antibiotics.
You'll have many viewers who go to get their reliever puffer, from their pharmacy, but they can't get their preventative puffer. You'll have now got women in Queensland who can receive antibiotics for uncomplicated urinary tract infections instead of having to wait many hours at an emergency department or many days to see a GP.
But what would a Medicare overhaul cost? The PM made it clear this morning more work needs to be done before money is set aside in the budget in May.
What we know we need to do is to fix primary health care, because if you don't get primary health care, it ends up costing more.
It's understood the states and territories have been pushing the federal government to relieve pressure on the hospitals for some time now. It appears their calls are being answered. Bruce Willett from the Royal Australian College of General Practitioners says it's high time for an overhaul.
That the government's going to be looking at building better teams around general practice, and I think that is the way to go.
The Strengthening Medicare Task Force will release its review into the scheme in the coming weeks, providing a pathway for reform. Olivia Casely, Sky News, Canberra.